anyway, and he said, I won't touch it for at least a year.
Yeah, there's got to be some problem in there, right? Yes?
Yeah, I'm participating in a triathlon in September. Now, after I go see the orthopedic surgeon, and whatever he suggests, should I hold off on the surgery?
Well, what do you need in your knee?
I don't know yet.
Oh.
That's the thing. After I see him.
Well, the question is, you know, how able are you?
Walking, swimming, and bicycling.
I know. I've done that. And, you know, the question is, how is your knee functioning? If you can do that, you don't need a knee replacement.
Oh, okay.
Yes?
The gentleman that you had here earlier, said he was back playing tennis in 6 weeks. If somebody gets a knee replacement, do you know of anybody that ends up going back to skiing and running and...
Oh yeah, there's no question about it. I'm not telling you that it's a good thing to run, to jog on it, although using a treadmill and moving along pretty fast in the treadmill is probably excellent. I mean, I was a jogger, and I would not encourage somebody to go and jog on the knee extensively. I think some running on a treadmill is good. Skiing, there's no problem with that at all. There's almost, you can participate in almost every sport there is, other than those that really pound a lot on it. And even that'll probably hold up, but you don't want to push it that much. But exercise machines, elliptical, treadmill, skiing, all types of playing tennis, golf, traveling, climbing mountains, people do all that, and they've had knee replacements and hip replacements. Yes?
If you have one knee that you know needs to be replaced and the other knee is starting to show symptoms, do you recommend getting both done?
Well, I do a lot of people who have both knees, but they have both knees that are pretty worn down, and you know they need both knees. You know, it's a matter of gauging how bad each knee is, and we can tell a lot more from an MRI as to how destructive the cartilage surfaces are. If the surfaces are really worn down, you know, the question is it ever going to return, or is it just going to continue to deteriorate? So in situations like that, when it's really symptomatic and both knees are bad, we'll do both knees at the same time. Yes?
Is there any particular trauma to the knee that would cause you having to need a knee replacement?
Yes. If you have a bad fracture of the knee, and you fractured through the surfaces of the joint itself, and you know, we're really more advanced nowadays. Nowadays we're able to bring the knee together much better than we did years ago. But very often, if you have a fracture that goes through into the joint, you can end up a number of years later developing what we call post-traumatic arthritis after having a fracture. And in that situation, somebody who's 35 years old might need to have a knee replacement. Yes?
How would you interact with an intern or cardiologist or whomever that does not belong to Boca community?
No problem.
Interaction, or do you need to establish a whole new set of physicians?
No, you don't. And we have this all the time. I have people that I treat from Wellington, we'll say, or whatever, and they have their internist there. What they do is they see their internist. We send them a note so they know what we need. And most internists know that if a patient is going for surgery, what basically clearance he'll need, medical clearance. And they send, nowadays with fax machines and all that, they send a copy of the lab reports, they send a copy of the electrocardiogram, and they send a note that says that here's the medical condition, it's satisfactory. If
would come to see you.
Yeah, and it would come to my office and goes to the hospital. If somebody doesn't have a doctor that way, or then we can send them right to the hospital here to get lab studies done and blood work and all that. But that's easily done through your own physician, and doesn't have to be a